So I'm Maithri Goonetilleke. I'm a GP and I'm an Associate Professor of Global Health at Monash Uni. I've worked for about in and out of Sub-Saharan Africa for the last 15 or so years, where I set up an NGO which is now peopled and managed by local Indigenous Swazi people in Eswatini, and I look after the global health programs here at Monash. I've always been interested in global health. I came from Sri Lanka when I was 6 years old, and I think being an immigrant, you see that sense that you are a citizen of the world. I think with Socrates, he said, I'm an Athenian, I'm a citizen of the world, and that's how it was felt. So, I've always had that interest. And then when I went to Swaziland in my final year of medicine, I was just astonished by the beauty of the culture and the place where I was working, but also just the incredible disparities in health which exist across the world. Working in a place with the highest prevalence of HIV in the world, and a place where there's a huge proportion of people living in poverty, really opened my eyes. So since I graduated medicine and went to Swaziland for the first time, there has been huge changes. The life expectancy when I first went was only 31. With the advent of specialised medications for HIV, antiretroviral medications, we saw a big increase in life expectancy. So it's now up in the late 50s, early 60s. So it's a big difference. But also, we've seen big advances in terms of education around, of safe sex and all of those kind of things in the area. That being said, a lot of the issues that were there when I first went continue to be pernicious, and those are the ones around sort of more geopolitical instability in the region, and the insidious nature of a lot of these structural factors which are impacting on the health of local people, which they often aren't even aware of. Possible Dreams International, which is the organisation which I set up and is now managed by local Indigenous people, really has a focus on Indigenous people at the centre of the story. And I think that is something which I'm really passionate about. Global health, as you know, has a not so nice history when it comes to the ways in which people from high-income countries have engaged with people from low and middle-income countries. And one of the reasons why I think PDI has the impact that it has is because we're not just partnering with the community, we're part of the community, and the people that run that organisation are Indigenous local people, and that is a really big lesson. It's been a huge lesson for me in my education in global health. Yeah. My clinical practice has been greatly influenced by my work in global health. I think mainly in that clinical practice, as you probably are aware, can be very reductive. We think about patients in terms of signs and symptoms and disease processes. And often that's just necessitated by the fact that we only have 15 minutes with that patient at a particular time. But as we're also aware, there's all these other invisible, more structural, more social forces which impact on the health outcomes that we're seeing. And often what we do in clinical practice is put a band-aid on a situation which has a far deeper root. And global health has given me a different lens through which to see clinical medicine, and that is the lens, a more structural lens, where I'm looking more holistically at the bigger picture. I think global health has always been a little bit niche in terms of there's a particular group of people that seem very passionate about it, and often they spend a lot of their lives traveling. And so because of that, it's been the case that a lot of universities haven't had global health leaders that are actually situated, planted in that community for any length of time to be able to create a flourishing global health program. And I think that's changing because people are recognizing that the only way forward for us as healthcare workers, as health leaders, is to have really strong centres of global health in academic institutions around the world that can then collaborate, that can act as a hub or a nest for all the global birds to come to. So there is a real burgeoning movement towards both global and planetary health at Monash University at the moment. So it's exciting to be a part of. So each year I go to the World Health Summit as part of my role at Monash, and the World Health Summit happens in Berlin each year. Last year I had the honour of being selected as one of the young physician leaders of the world, which is the 20 doctors under the age of 40, which are selected each year by the World Assembly of Sciences. And they represent people from a diversity of backgrounds who come together and talk about what are the crises that are facing the world and what can we as young doctors do to change things, to make structural, lasting changes. It was phenomenal to be selected. It was incredibly humbling to be able to realise that even though global health can feel so niche, there are some extraordinary people around the world who share your passion and who are, singing from the same song sheet, and it is incredibly edifying and fortifying to understand that you're not alone in this work. So as young physician leaders, we were talking about all of the challenges the young doctors face when trying to change the global health. And those were structural in, how do we as young, passionate young people talk to generations which are sort of solidified in their thinking about a lot of these global issues? How do we challenge them respectfully? And also, how do we sort of work within these systems which we feel often are oppressive? So those were some of the conversations that we had, and then it was also around how do we inspire other doctors to understand that actually this is, global health shouldn't be niche. Global health should be the responsibility of every doctor, and that's the greater challenge. So, we had some amazing conversations, and I think fundamentally it was also understanding that the challenges are very similar. We might be in different contexts, but we all sort of sat together and went, oh, okay, so you're feeling that too. So they call you, they disrespect you too, and it was great to be in that space. Yeah. The advice I'd give to students is, first of all, don't be discouraged. It seems, incredibly overwhelming when you think about a career in global health. I'd say go for it, but at the same time, I'd say if you're really passionate about this area, and I know some people it's just in them, it's just a driving ambition, I would say you have to temper that with humility, and that humility should compel you to learn not just about disease processes affecting a particular region, but about the geopolitics of that region, about all of the social and structural factors that are influencing that region, and about the history, very crucially, about the history of foreign engagement with that region. Has it been wholly positive? In the vast majority of cases we see in places like Southeast Asia and Africa and South America, you would see that a lot of that interaction has not been positive at all. So, with all of the best intentions, it's possible to walk into a place and reproduce harms which you didn't even know existed, and the challenge of global health is to be able to understand and be aware of that before you go in, so that you mitigate the harm that you might cause.
COVID-19 has had a devastating impact, as we know, on health systems around the world. I think for me, as someone who's invested in global health, as a global health practitioner, what concerns me is the movement towards isolationism, not just by closing borders, which we had, which everyone knows we had to do as part of the public health measures that we took, but a movement away from the multilateralism which was characteristic of the last 20 years, the multilateralism which allowed us to understand that by improving the health of low and middle income countries, we were actually improving the health of the world. What often happens when a new virus or disease emerges is that the conversation discourse is not just from healthcare providers, as we've seen. It's often deeply tinged by other sort of political agendas. And that's what we've seen with COVID-19. So people have leveraged the social isolation that we need with COVID for their own political agenda to say we shouldn't be sending money to these countries, we shouldn't be investing in the World Health Organization. So structures which have been hard fought to create over many years, which actually help with deeply important issues affecting global health like HIV, malaria, TB, new and emerging pandemics, Ebola, everything else that we see around the world, and also the social and structural issues that lead to things like neglected tropical diseases in parts of Africa, which are deeply connected to socioeconomic destitution in those regions. So by putting all of our money and resources into COVID, what happens is those programs are divested of funds. And when that happens, you see insidious problems emerging. In Swaziland, COVID-19, for example, is not the number one health issue. HIV is. 26% of the population being infected. What happens when all of those poor people in rural areas that already were struggling to go to hospital to get their HIV medication are placed into lockdown? What happens to their health and their health outcomes then? If there is no conversation about health holistically and or at a global level, then the whole world is poorer for that. One of the great challenges that we face is always to translate our knowledge into a language that others will understand readily. And I think one of the most important things that young doctors can learn is not to get so full of yourself and so caught up in speaking a beautiful medical jargon that you stop being able to communicate effectively with the population, the communities that you work with. Because the moment you lose that, then you actually become impotent. You stop having the power to impact the public health. So communication is incredibly important.